My name is Brendan Street. I'm Professional Head of Emotional Wellbeing with Nuffield Health. Just a little bit of background about me before I start. I've worked in mental health for over 25 years now, initially as a psychiatric nurse within the NHS, and then more latterly as a cognitive behaviour therapist, a CBT therapist and supervisor. For those of you that don't know, just to give a little bit of context as well about Nuffield Health. So Nuffield Health is the UK's largest healthcare charity. In essence, that means that all of our income is invested back into the charity to develop our services, to improve our services, and to deliver things like our flagship programs, which deliver services to people that wouldn't normally be able to afford them. We deliver our services across areas in terms of our hospitals, so 31 hospitals, we've got 112 fitness and wellbeing centres, and we've got over 200 corporate sites. In terms of emotional wellbeing, my part of the business, we deliver service across all those areas in terms of enhancement, so people that are mentally fit that want to be fitter, through to prevention, people that are experiencing a degree of stress but don't want to get any worse, right up to treatment, so people who are experiencing a degree of mental ill health and require treatments such as cognitive behaviour therapy or counselling or things like that. In terms of my presentation today, and I'll just open the presentation for people, hopefully people can see my screen. More than words. So why does language matter in mental health? And as I said previously, I've worked in mental health for over 25 years, and I've never seen such a shared experience of distress that we've had due to COVID. And I think that it presents a real opportunity, this shared experience of distress. If there's an opportunity here to bring about change, I think together we can use the shared experience of distress to empower conversations around mental health. And I think if we can encourage a different way of talking about mental health, I think then we can help more people access the support they need earlier. That's important because we don't leave people in distress for as long in the workplace, but also massively important because any investment that you make as an employer, you get much more of a return on investment the earlier we intervene. Now, in terms of that, the impact of coronavirus on our mental health, how has it affected the nation's mental health? Well, at Nuffield, we've been keeping an eye on that, and we've been doing surveys throughout COVID-19, and we found that 62% of us felt that our mental health had worsened during lockdown. Slightly different in terms of when you look at adults, it was around 60%, and then when you look at young people, it was much more, it was 68%. The Centre for Mental Health, the stat there in terms of that up to 10 million people will need new or additional mental health support due to the impact of COVID. Now that's 20% of the whole population. It's been said that the coronavirus poses the greatest threat to mental health since the Second World War. And I'll come to it in a minute, but it's not impacting us all equally. So young people are more likely to have experienced poor mental health during the lockdown, and also people with mental health problems that were existing already are more likely to see their mental health worsen as a result of coronavirus. If then we look at these demographic groups, and I think it's important as employers to look at this, those demographic groups within our employed workforce facing greater challenges with their mental health. We won't go into all of them here, but you can see that those with learning difference are impacted more in terms of their mental health. Young people, again, like I said, 18 to 24, and young people is a recurring theme throughout this talk. BAME communities, women, carers, non-binary people experiencing social deprivation. So a really big call out here. Poverty and living with low resources has often been seen as the cause of all causes of mental ill health. It seems that COVID has really amplified this, and people who are living with low resources are more prone to the negative impact on their mental health of COVID. Those employment status changed as a result of coronavirus, and another call out is those that are lonely. So people experiencing loneliness during COVID, and bear in mind you don't have to be alone to be lonely. You can be surrounded by other people, and also you can be alone and not lonely. But a key watch out, I think, for employers is how coronavirus and this amplifier of inequality is impacting on those that are lonely. Also, it's worth bearing in mind that this mental health need that I talked about before, so these 10 million extra people, it's worth bearing in mind as an employer that that mental health need is likely to echo the COVID need. So in terms of the COVID-19 practical needs that we're all seeing at the moment, the mental health need is coming as an echo after it, and we need to keep an eye on that. We've just come out of a superstorm that was the winter, in terms of those financial insecurity you get, winter changes, COVID still going on, Brexit back again, seasonal flu. So we've just come out of that superstorm, but we're likely to see the impact of that on mental health echo later on. Now, what lessons can we learn from before COVID? Because despite the fact that we were talking a lot more about mental health and there was a lot more visibility about mental health in society and in the media, there was still this disconnect in the workplace. What do I mean by that? Well, studies back in 2017, this study here, less than 5% of employees who'd experienced anxiety and less than 4% of employees that had experienced depression felt able to talk to their manager about it. And then when they asked the employers, so this was quite a big study, it was I think it was 2,000 employees and 200 employers, and then when they asked the employers whether they believed that their employees would be comfortable talking about their mental health in the workplace, the employers said yeah, of course they would be. So there's this, almost like this double disconnect. Other research seems to back this up. Business in the community do a study every year in terms of mental health in the workplace. It's called the Mental Health at Work report. 2018, only 16% of employees felt able to talk to their manager about mental health or emotional well-being. And 11% of employees who did faced dismissal, demotion or disciplinary action. So a real disincentive to talk about your mental health. And the stat there that's really shocking, 300,000 people with long-term mental health problems lose their jobs every year, and that's at a much higher rate than those with physical health conditions. And it seems to be, and bear in mind, that's the population of a city like Leeds every single year. And that seems to be that because they're not able, or they don't feel able to talk to their employer about their mental health needs, reasonable adjustments aren't made, so they drop out of the workplace, and we lose the population of Leeds every year. Even more up-to-date stats in terms of the Mental Health at Work report in 2020, 70% of managers were still saying that there are barriers to providing mental health support to employees, and 30% of employees told nobody about their mental health. So still a problem, and I'm keen that we use COVID so that we don't repeat this, because even in then, and the report in terms of the Mental Health Foundation, year on year found that 9 out of 10 people with mental ill health say they've experienced discrimination because of it. And why should it be a business priority anyway? Why are we bothered about mental health? Well, if you look at, and this is the most recent stats in terms of 2020, Deloitte did this study back in 2017, and there's been a £6 billion increase in terms of the cost to employers of mental ill health and poor mental health per year, and the estimate is about 42 billion to 45 billion. It's increased due to presenteeism costs. So there's and that cost there is for all employees, not the ones that are just ill. So it's about £1,652 per year per employee that poor mental health cost employers. So there's a real business incentive, but I think more than that, there's an ethical incentive. It's the right thing to do. If you just look at suicides, so in the UK and Northern Ireland in 2018, there were 6,859 suicides. That was 19 every day. There's been a 94% increase in the suicide rate for females since 2012. In 2019, the stats aren't out just yet. It was the highest it's ever been. And again, coming back to young people, and a really big call out in terms of the impact of COVID on this, 16 to 24-year-olds, suicide is the biggest killer. For those between 20 and 24, causes reported for suicide tend to be around finances and housing. Again, a key call out in terms of employers, in terms of the impact of COVID. So why aren't these conversations, or why weren't they happening, because hopefully we can use COVID to make sure conversations happen. But why weren't they happening? Either not happening at all, or they were occurring but in a really simplistic way. Now I think there were probably three reasons that we need to watch out for and learn from in terms of the opportunity that COVID gives us. So there's no way. So employers just didn't feel able to have the discussion. There was fear. There's no how. Employers didn't know how to have the discussion, so they didn't have the language to have it. And there's no why. They didn't see the reason to have the discussion. What's going to be the outcome for me if I have this discussion about my mental health? So we look at no way. What does no way look like? So again, and lessons we should learn. Back in 2017, the Institute of Directors reported that there was this fear of not being promoted. The reason why people didn't feel able to, that they feared of not being promoted, they thought they'd be seen differently, and so they don't put their head above the parapet in the same way you might do for physical health. This survey here of city workers is really really common, and I see it all the time in terms of my clinical practice in the city. Revealed that 70% of people believe that if they ask for help, they'd look weak or hurt their career. Now I think there's a key call out here in terms of COVID. If you think of the environment that we're likely to be in as we come out of COVID, it's going to be financially more difficult. People are going to be a lot more worried about their jobs, and this real fear, this no way, could rear its head again unless we're careful. What about the no how? Well, what do you need to be able to have a conversation about mental health? Well, I think the first thing that you need is words. Now, on this chart here, the words in red are words that exist in other languages that we don't have a translation for in English. And it's interesting because there's a word up there, ikt Don't know if anybody knows what ikt means. It's an Inuit word, and it basically means that degree. I don't know if people can remember when we were able to have people around at our houses and have dinner parties, but it's an Inuit word that basically means that degree of anxiety or itchiness you get when somebody's due to arrive and you're not sure what time, and you're up and down at the window checking to see whether they're there or not. It literally means that. And I mention it because it's a word that makes sense to people. When you hear it, you think, oh yeah, I've had that. Whereas a lot of the words that are associated with mental health aren't words like that. We tend to have disorder, condition, post-traumatic stress disorder, obsessive compulsive disorder, words that don't mean anything to me as a human being, words that I don't feel confident in using. In addition to that, the other thing that you need in order to have a conversation about mental health is a language framework. Now, unfortunately, the language framework for mental health, and it's a subject for another presentation, but got toxified really early on. I don't know whether anybody knows where the phrase "round the bend" comes from. Well, it's a phrase that comes from when the asylums were built in the 18th centuries. They tended to be built down the end of a really long pathway slightly round the bend. And the reason they were slightly round the bend was to keep what was going on in the asylum, so that people suffering from mental ill health, away from the community. There was that sense of shame about what was happening there. And you see that the newspaper headlines here that the language, the framework around mental health got toxified during my youth. We probably wouldn't see these headlines now, but they're still there. So the bonkers Bruno is still there. The madman in the cockpit, which wasn't that long ago, really. It was probably 2015. Words like snowflake that are bandied around. So it's almost like it's not okay not to be okay. Again, toxifying the language about mental health and making people not willing to talk about their mental health. If you look here, I don't know whether people know what the grayed out word is. Yeah, it's committed. Committed is often associated with the word suicide. Again, what else do we commit? Crimes or sins. Again, this degree of shame around the language of mental health, making people less likely to talk about it. What about the know why? Now, if I'm going to talk to my employer about mental health, I need to know what's the purpose of it. Why when I speak to my employer about my emotional well-being and mental health needs, I need to see that it'd be helpful for me to talk about it. I need to see that I'm going to get something out of it. And I think often employees don't see that they're going to get anything out of it. A study in 2017 said the vast majority of employers would just refer the employee to their GP. And we need more than that. If I'm going to be confident in talking to my employer about mental health, I need to be provided with a range of visible options, almost like signposts to say why there's a reason for a conversation. And that I know that within my workplace, a dialogue about emotional well-being and mental health is both welcomed by you and expected. And again, it's grasping hold of this idea that mental health is much more than the absence of mental ill health. And we don't think about mental health like that. When you hear mental health, many of us will think mental ill health. And we don't know do that with physical health. And why is that? Well, I think one of the reasons is we've got stuck with this 1 in 4. So I think we need to move away from the 1 in 4. So 1 in 4 of us will experience a mental ill health during the course of 12 months. And I think we need to move to a message of 4 in 4. So 4 out of 4 of us have emotional well-being needs, and these needs change day to day, week to week, year to year, depending on what's happening in our lives and how we perceive it. And these needs require just support for all of us, and this support ranges from enhancement, so when I'm mentally fit, how can I be mentally fitter, to prevention, I'm experiencing a degree of distress and I don't want it to get any worse, right up to treatment. And I could be anywhere on that continuum depending on what's going on in my life. And I think the difficulty with the 1 in 4 is great because it shows how common mental health problems are, but one of the problems with it creates a bit of a them and us. It's a bit othering. I don't know about you, when I hear a stat like 1 in 4, psychologically I'm over here somewhere with 2 other blokes, and this person is over there with the mental ill health. Now I feel sorry for them, but I don't see any responsibility for me to have a conversation. Whereas a 4 in 4, there's all of our responsibility to talk about mental ill health. So, for example, oxygen needs. If oxygen needs were compromised in the workplace, we'd find solutions really quickly. We'd be willing to talk about it if we had the breath to do so, but we'd be willing to talk about it because it's something that affects us all. And I think the difficulty with 1 in 4 is it's a bit othering. I think the other difficulty with 1 in 4, and I'll come to this in a moment, is that it's very diagnostic led. 1 in 4 means the problem is with me, it's in me, and we're likely to want to treat the individual and particularly in the workplace and post-COVID, look at what are the other causes. So 4 in 4 is a bit more about what has happened to you. It's a bit more distress led. It takes the diagnosis out of us. We're more likely to look at the whole picture and listen. So we all have emotional well-being that just vary depending on what's going on in our lives around us. So does COVID-19 provide an opportunity for change? And as I said at the beginning, I think it really does provide a massive opportunity for change. Just going back to that statement that I made at the beginning. And during 2020, we had an expert panel webinar. Myself was on it, Dr. David Kreppers-Kay from the Mental Health Foundation, Dr. Radha Modgil, who's a GP but also a broadcaster with the BBC, and Dr. Alex George, who many of you will know is now the Youth Ambassador for Mental Health. So we had an expert panel webinar in 2020 with these members, and we discussed what I've just discussed now in terms of mental health and a new way of looking at talking about mental health. And we came up with a paper which was called More Than Words, which discusses all the things that I've discussed in this presentation in a bit more depth. Also, we came up with some collateral, so some information that employers can use to improve those conversations within the workplace. And if you click on the QR code now, you'll be able to access those resources. And I think key to that, and again I'll come back to it because I think it's important, is this idea of a continuum. that we all exist on this continuum that you can see here, from crisis up to excelling. And because we all exist, depending on what's going on in our life, and post-COVID will bring with it challenges, we're going to need interventions in terms of treatment, prevention and enhancement. And I think if you look at mental health's always been called the Cinderella of health. It's always playing catch up because we don't really spend enough in terms of research on mental health. For example, if you look at spending in terms of every person that experiences cancer, we spend 22 times what we spend on mental health research on cancer. And because of that, we don't really know enough about mental health, and because we don't know enough, no wonder we don't know what to do when we don't do enough. But I think changing the way that we have conversations about mental health is a really powerful way to improve engagement, get people to talk earlier to us, because you can have all the interventions within the workplace that you want, all the fancy interventions that you want, but if people don't feel confident about talking about mental health, they're not going to access any interventions.